He says once a person is tested for COVID-19, the sample is then taken to the laboratory, which takes about 2 weeks to detect if the person has Omicron. He says with the new variant said to spread faster than Delta, Namibians need to be extra careful.
When you do your PCR test for COVID, that test does not determine the type of variant that you have. We have detected Omicron in Namibia. The laboratory at the University of Namibia conducted genomic sequencing last month, and the results came out. We had tested 19 samples, and 18 came back positive with Omicron. So we do have that capacity to detect the variant circulating in the country.
A number of hospitals across the country have reopened their COVID-19 wards, he says, given the rise in COVID-19 cases. As of yesterday, Namibia reported 540 COVID-19 cases, bringing the total number of active cases to 4,913. 152 patients are hospitalized, with 13 being cared for in intensive care units.
Genomic sequencing is a process, as I said, that comes after your initial PCR test has been conducted. So what would ordinarily happen, and this happened, for example, with the Delta variant, is that if a particular variant is more easily transmissible, it can replace another variant which was circulating to become the dominant variant in the country. So the next round of the genomic sequencing that is going to be conducted will determine the percentage of the prevalence of Omicron in Namibia and whether Omicron actually can be said to be the dominant variant circulating.
The ministry further encouraged people to get vaccinated to curb the spread of the virus. Luciang Ifindaka, NBC News, Windhoek.